So, you've started taking ADHD medication. And hey, things are probably a bit better, right? But maybe you've got this little voice in the back of your head, a nagging question that keeps popping up. Today, we're going to talk about how to go from, yeah, this is okay, to wow, this is optimal. Let's dive in.
And that's the question right there. Is this all there is? So many of us ask this. You feel a little improvement, things aren't quite as hard, but is this it? Is this the big change everyone talks about? That feeling of uncertainty? Well, that's exactly where we're starting our journey today.
All right, so here's the game plan. We're going to tackle that uncertainty head on. First, we'll figure out what success even looks like. Then, we'll get into the different kinds of meds, the whole art of finding that perfect dose, what happens when the usual stuff doesn't work, and, this is the big one, how you can become an active partner in your own treatment.
Okay, first things first. You can't optimize what you can't measure, right? So how in the world do you actually track if your ADHD medication is working? It's got to be about more than just a vague feeling of, I guess I'm better.
And that leads us right to the million-dollar question. See, the goal isn't just to find any dose that works. It's about finding the best possible dose, the one that's perfect for your brain, your body, your life. And honestly, the way we figure that out, it's probably not what you think. Okay, check this out. The most important concept here is something clinicians call the optimal dose curve, or you can just think of it like an upside-down V. It's simple, really. As you start with a low dose and slowly increase it, your focus and performance go up, up, up. Then you hit this perfect sweet spot at the very top. That's your optimal dose. But here's the catch. If you go past that point, your performance actually starts to go down, and that's when side effects pop up. So remember, more is not better. Optimal is better.
And here's a perfect picture of what happens when you go over the top of that peak. Clinicians have these awesome, kind of funny names for it. On one hand, you've got Starbucks syndrome. You know that feeling, right, like you've had way too much coffee, you're jittery, irritable, your heart's racing? Then there's the other side of the coin, zombie syndrome. This is where you just feel flat, blah. Your personality's gone, you're slowed down. If you feel either of these, it's a huge red flag that the dose is just too high.
So how do you track your climb up that curve? Well, for kids, docs have all these formal tools, standardized scales, computer tests, the whole shebang. But for us adults, the most common and effective method is actually surprisingly simple. It's called the SWAG method. All you do is rate how well it's working on a scale of 1 to 10. And listen, the goal is an 8, 9, or 10. If you're hovering around a 6 or lower, that's just not good enough. Okay, so now you know how to tell if it's working. The next piece of the puzzle is finding the right tool for the job. When we're talking about the main stimulant meds, it almost always comes down to choosing between two big families of molecules. Now, before I show you some really powerful numbers, you need to know one quick term. It's called effect size. Don't let the name scare you. It's super simple. It's just a number that scientists use to measure how well something works. That's it. Bigger number, bigger effect. Got it? Good.
Just look at that number, 1.8. That right there is the potential effect size of an ADHD stimulant when it's optimized correctly. And let me put that into perspective for you. An effect size of 1.8 is one of the highest, most powerful results for any medication for any condition in the entire field of medicine. That's not just good, that is incredible. The potential here is absolutely huge.
So which molecule gets you there, amphetamine or methylphenidate? Now this is where it gets really interesting. If you look at big groups of people, they both work equally well. But for you, as an individual, there's a really good chance you'll have a strong preference. You can see here about 37 out of 100 people just do way better on amphetamines, while another 26 do better on methylphenidate. And there's no way to know which camp you're in until you actually try them.
And here's the really great news. The odds are just massively in your favor. When you look at both of those medication families together, a full 85% of people with ADHD find one that works great for them. That is an amazing success rate. So there's a really, really high chance you're going to find your fit. So you know how to measure success, and you know the main options you're trying. But how do you actually do it? How do you find that sweet spot, the very peak of that upside-down V? Well, that process has a name. It's called titration, and it's both an art and a science.
Okay, first, let's just blow up a huge myth right now. A lot of people think their dose is based on their weight or their age. Nope. As the great Dr. William Dodson says here, there is absolutely nothing, not your weight, your gender, your age, nothing that can predict your perfect dose ahead of time. It has everything to do with your unique brain chemistry, which means finding that dose is all about a careful, one-of-a-kind process of fine-tuning.
And this is exactly what that process looks like. It's super methodical. You and your doctor start at the lowest dose you can. Then, usually every week or so, you bump it up to the next level. You keep doing this as long as you're seeing more improvement and you're not getting any of those weird side effects we talked about. Now, here's the key. The moment you take a higher dose and think, you know what, I don't feel any better than I did on the last one, that's when you stop. The dose you were on right before that one, that's your optimal dose. It's really that straightforward.
But what about the other 15%, right? What if you're one of the people who tries both stimulant families and nothing? Or maybe the side effects are just too much. I know that can feel really discouraging, but I promise you it is not the end of the road. Not even close. There's a very clear path for what to do next.
A good clinician, one who really knows their stuff, isn't going to give up. First, they'll step back and say, okay, let's just make 100% sure the diagnosis is correct. Then they'll check for simple stuff, like, are you washing your meds down with a big glass of orange juice because the vitamin C can actually block it from working? After that, there are whole other classes of medication to try, like alpha agonists or non-stimulants. The main takeaway here is there are always more options.
And that brings us to what I think is the most important part of this whole explainer. Because look, all this information is great, but it's only powerful if you actually use it. And that means making a shift in your mindset, from being a passive patient to becoming an active, informed partner in your own healthcare. Okay, I'm going to share a fact that might be a little shocking. And it's not meant to scare you, but you need to know it. Up to 90% of adult psychiatrists get zero training on how to diagnose and treat ADHD. Let that sink in. This isn't about blaming doctors. It's a problem with the system. But it shows you exactly why it's so important for you to be your own best advocate. So the big question is, where do you find a doctor who really gets this stuff? Well, you have to go where the experts are. Local support groups like CHAD are an absolute goldmine for recommendations from other people who've been through it. You can ask an ADHD coach, talk to a school counselor, or check out the professional lists on websites like ADDitude Magazine. Yeah, it might take a little legwork, and you might even have to pay out of pocket for a real specialist, but finding that person you can be a true partner in this, it's worth everything.
So we're ending right back where we started, but now everything's different. You're not just wondering anymore, you have the map. You know about the optimal dose curve, you know about titration, you know how to be a partner. So you can stop asking yourself, is this all there is? And start asking your doctor a much more powerful question. How do we get to optimal?